Hello friends, it's pleasure to have you back on the channel of Clinical Care Insights. We started a series of lecture about the neurodegenerative disorder. Okay, until now we discuss about the what is called as neurodegenerative disorders. Okay, and we also discussed that there are two types of neurodegenerative disorders. Okay, the first is called as the Alzheimer's disease, which we already covered in our previous class. In our today's class, I'm going to discuss about the another disease that is called as the Parkinson disease. Okay, these two diseases, they are basically a neurodegenerative disease. First of all, the second things which we have to keep in our mind is that these diseases, they mostly occur in the old stage. Okay, or a later stage of life. Fine. So here is the today's lecture outline. What things we will cover in our today's class. First, we will discuss about the introduction of the Parkinson disease or overview of Parkinson disease. Okay, then we will discuss the neuroanatomy and the pathophysiology of this disease called as the Parkinson disease. See why it's important to first understand the function, because once you understand the normal function, okay, you can easily encounter the abnormal function. Okay, if you know the mechanism, how you can say that in a cell at a cellular level how our body is functioning, so if there is any deformity or any malfunction, okay, we can correct by appropriate drug or surgery. Okay, fine. So we will see first the neuroanatomy, and then we will discuss about also the pathophysiology of Parkinson disease. Okay, now, then we will also discuss the clinical features that once this disease started in a person, okay, what characteristics this disease shows, okay, what are the signs and symptoms basically. Then we will discuss about that the diagnosis, how we can diagnose a Parkinson's patient, okay. Then we will discuss about that what are the treatment and management. Got it? I hope you watched the Alzheimer's disease video. If you not watched, please I will put the link, you can check out the links. Fine. So let's start with the Parkinson's disease. Now, probably many of you have heard about this disease, Parkinson's disease. The Parkinson's disease is basically a neurodegenerative disorder. Okay, Parkinson's disease. Parkinson's disease. It is a neurodegenerative disorder first of all, and also it is a progressive. It's a progressive. Now, what I mean by the progressive? Progressive means, okay, as the course of disease is, you can say, going on in a patient, the symptoms start to become worsening. Okay, symptoms start become worsening. Okay, so severity of system, like you can say the symptoms is increases. Okay, during the course of this Parkinson's disease. That's the first thing. So that's why they are called as the progressive disorder disease. It's a progressive neurodegenerative disorder. Neurodegenerative disorder. Now, why it is called as Parkinson's disease? Just because there is one neurobiologist named James Parkinson. Okay, his name is James Parkinson. He discovered this Parkinson disease in 1872. That's why this disease is named as a Parkinson's disease. Now, another thing about this disease is that there is no any permanent cure. As we discussed, no, that the all the neurodegenerative disorders, okay, their treatment, you can say the protocol or treatment guideline is just a symptomatic. Okay, we don't have till now, up to now, we don't have any drug which can reverse the disease state, okay, or which can cure the disease. Fine. So if we talking about the treatment, then treatment goes with symptom. So there is a symptomatological treatment. Symptomatic treatment. Fine, no problem. Now, if we're talking about the prevalence rate, okay, then it is estimated that after the Alzheimer, it is the second most death-causing disease. If we're talking about the neurodegenerative disorder mortality rate, okay, then after the Alzheimer, it is the second most death-causing disease. Okay, second most disease, or you can say death causing disease after the Alzheimer. Alzheimer is the first. Fine, no problem. Now, if we're talking about the prevalence, okay, according to the gender, then there is a equality means it can affect equally both in the male and female, but some research show that it mostly affect the men. Fine, but there are certain studies which shows that this disease basically affect both male and female. Got it? No problem. Now, coming to the another point about this disease is that we discussed that the neurodegenerative disorder, most of the neurodegenerative disorder, they are genetic. Okay, they are genetic. But this disease, Parkinson disease, here the genetic inheritance is not well established. Okay, there are certain genes which is associated with the, you can say, Parkinson disease, but yet it is not clarified. First thing. Second thing is, if we're talking about the etiology of this neurotransmitter disease, then environmental factors affects more as compared to the genetics. So if we're talking about the etiology, then genetic is poor, okay, whereas the environmental factors here dominate. Okay, environmental factors dominate. Clear? No problem. Now, this disease and the Alzheimer disease both are associated with the abnormality in the nervous system, basically in the central nervous system. Okay, we will talking about specifically, then it is the neuron where these abnormalities occur in these neurodegenerative disorders. So if we taking the overview what happened actually in the case of Parkinson disease, then there is dopaminergic neuron death. Okay, so there is a dopamine dopamine secreting neurons. Okay, dopamine secreting neurons, it will die. Okay, and you know that dopamine is a reward hormone. First of all, the one thing is about the dopamine is it is a reward hormone. Another thing is that the dopamine is a inhibitory hormone. Dopamine is a inhibitory hormones, means it inhibit the other neuron. Fine. Now, we discussed about so many things about this Parkinson's disease, but yet we not understand that what actually happens in the Parkinson patient. So we will discuss in this feature in a clinical features. Okay, we will see the, you can say, the signs and symptoms under the clinical feature heading. But for a while, you just understand Parkinson disease is basically a disease for the motor function. Okay, so it is a motor disorder. Motor disorder. Okay, no problem. Just quickly recap what we studied. Basically, a Parkinson is a motor disorder. Okay, it is a progressive neurodegenerative disorder. It is discovered by the James Parkinson's. That's why it is called as the Parkinson disease. And the treatment is mostly the symptomatic. Okay, and it is the second most death-causing disease after the Alzheimer. Then it's affect equally both. It's affect equally men and female. Fine. Here, genetic play a poor role and environmental factor dominate if we're talking about the etiology of this disease. Then, what actually happens in disease, there is a something called as the dopaminergic neuron or dopamine secreting neurons. They start dying. They start dying. Fine. Now, there's two terms which you should have clear idea about that. One is called as the Parkinson disease. Another one is called as the Parkinsonism. Another one is called as the Parkinsonism. Now, generally, a student confuse these two terms. See, Parkinson disease is one specific motor disease, whereas Parkinsonism disease are all those diseases where the motor problems occur. Where the motor problems occur. So, it is basically a term which defines the motor abnormality, whereas the Parkinson disease is a one specific disease where specifically the dopaminergic neuron start dying. Dopaminergic neuron start dying. Fine, no problem. We'll see the brain area where actually these neurons start dying. Fine. So this thing is clear in your mind. Now let's move forward and discuss about the neuroanatomy and pathophysiology of this Parkinson disease.